I'd like to start off by recognizing our sponsor for these series of calls. So that would be BMO Harris Bank. BMO Harris Bank has dedicated bankers in the local market who understand your business, your industry, and this market. They offer solutions tailored to your unique needs. BMO has deep roots in the community with a long history of supporting Forward Janesville and other local nonprofit organizations. Thank you, BMO Harris, for supporting these calls. Today we have three panelists who are going to talk about the pandemic, the COVID-19 pandemic and its latest variant, the Delta variant. And the panelists include Kelsey Cordova, Public Health Supervisor over communicable disease for Rock County. We'll have Steve Pufall, of course, the Superintendent of the Janesville School District, and Eric Thornton. He's President of SSM Health St. Mary's Hospital here in Janesville. If you have questions during the presentations, I encourage you to send them to forward@forwardjanesville.com, and someone will shuttle those questions into my attention. I'll do my best to ask them, time permitting, at the end of the call. So let's start today's conference call with Kelsey Cordova. Kelsey, welcome, and thank you so much for joining us. The floor is yours, and I'll look forward to hearing your comments.
Thank you. Thank you all for having me today. As John mentioned, my name is Kelsey Cordova, and I'm the Public Health Supervisor over the Communicable Disease Unit at the Rock County Public Health Department. Our health officer, Katrina Harwood, asked me to pass along her regrets for not being able to attend today. So I think I'll just start by talking about kind of one of our workflows over the course of the COVID-19 pandemic response. And likely much like our partners on the call today, public health has been stretched throughout the 18-plus months of this pandemic. Our health department responses to the pandemic have consisted of a case investigation for people who have tested positive and contact tracing to help notify people of their exposure. The investigations that we have completed for COVID-19 are very similar to the investigations our team completes for other communicable diseases throughout every year. The volume of case investigations and contact tracing we complete is evident through our disease surveillance dashboard maintained on our website. We have seen an increase in the number of people testing positive for COVID-19 over the past several weeks. This increase is suspected to be due to the Delta variant, which is now the most common COVID-19 variant in Wisconsin and has been shown in studies to be more transmissible than other forms of the virus. Throughout the pandemic, we have worked with the Wisconsin National Guard and other county departments to operate a COVID-19 community-based test site at Blackhawk Technical College. And while the community-based testing site closed at the end of July, we're now working with a private company to increase testing capacity again in Rock County. Because one of the important steps in getting ahead of this pandemic is understanding who may be infected with the virus so we can isolate and prevent the disease from spreading farther. We've been working on multiple fronts for vaccination. We have been coordinating with the Rock County Vaccine Advisory Committee to help ensure equitable access to the vaccine, and we have been tracking vaccination rates. We coordinated with the state and a company called AMI through the duration of the community-based vaccine clinic at Blackhawk Technical College. And since the vaccine became available to the general public, we have been offering many mobile vaccine clinics across the county. We have been fortunate to partner with our local schools for these clinics, which have proved to be very successful. At this time, we are awaiting further guidance from the Wisconsin Department of Health Services on the rollout of booster doses statewide, which is pending FDA and ACIP approval. We continue to be available for businesses and organizations who are looking to make sure their environments and events are safe. With the lifting of our prior public health order and capacity recommendations, we have received fewer questions of recently, but are still available here if a business or organization has any questions for us. And that's actually all I have for today. I'm looking forward to answering any questions that might come up later.
Well, thank you, Kelly. I'm sure there will be questions. In fact, I already have some, so stay tuned. I will repeat myself several times to the callers on this conference call that if you have questions for Kelsey or the other panelists, send them to forward@forwardjanesville.com. I hope we have Eric Thornton on the line. Eric, are you there?
I'm sorry, John. I don't have Eric and Steve. I am working on it.
Oh. Well, in that case, since the other panelists haven't dialed in yet, I'm just going to go right to some questions that we've already had submitted to us, Kelsey.
Okay.
Number one is, what is the most important metric or item you look at when considering implementing COVID-related health mandates for the county? Might it be test positivity rate, number of positive tests, or hospital utilization rates? This could help, of course, Forward Janesville members, looking at the publicly available data and trying to focus on what possibly the most important item is in planning ahead. Can you speak to that, Kelsey?
I sure can try. First acknowledging that the metrics that go into consideration for decisions like different orders or mandates or even our recommendations are multifaceted. We certainly don't just consider one or even a few different metrics when making those decisions. But I would say that one of our most important, or one of the trigger points for important decisions around our guidance, recommendations, and orders is on hospitalization, utilization, and availability. When we think about our ability to care for those who are sick with or without COVID in our community, we really need to make sure that we have the ability to do so. So we keep a close eye and work really closely with our healthcare system partners locally to monitor daily their bed availability, their staffing capacity, see how they're doing. So I say that would probably be, if you had to name one of the most important metrics that we consider.
So how are you scoring right now on these metrics? Very poor, okay, good. I mean, where are we as of today?
Sure. So it's a sliding scale. I think what we're seeing right now are trends in the wrong direction. So while we might not see the hospitalization counts like we had been last fall or this last winter, we're certainly increasing at a much faster clip and to places we haven't seen since this last spring. So over the last couple of weeks, all trends have been increasing in hospitalizations, which is not unexpected considering the increase in cases that we've seen. Oftentimes, increases in hospitalizations for COVID-19 come about 2 weeks after we start to see an increase in case activity. So we're right on cue for it, but it's definitely trending in the wrong direction.
Well, of course, there are a lot more community events, indoor events starting to pop up. Do you foresee any new restrictions on these indoor events coming forth? I mean, no, you can't make the decision yourself, but is it something that's being talked about?
So we are continuing to monitor and evaluate the data. Like I said, very multifaceted. A lot of different considerations go in. We're concerned about the increase in number of people testing positive, the increased transmissibility of the Delta variant, and our lower than optimal vaccination rate. Kind of all of those play into the decision-making process. Due to the level of transmission, we're recommending and strongly encouraging everyone in the county to wear a mask while indoors in public settings to minimize that spread of the virus, as we see an increase in events and people gathering. But that's where we're at. Like I said, it's kind of an ongoing evaluation process, something that we look at, think about, and evaluate every day.
Well, here's the most important question I think I have on my list, and that is, what steps do you recommend that businesses take right now to keep customers and employees safe?
Yeah, I think that goes back, kind of ties into the last question a little bit too. You know, as much as business owners and businesses can do to recommend and strongly encourage or implement practices that have everyone wearing masks indoors in public settings, and promoting vaccination. Just recently, the Pfizer vaccine received FDA approval. So I think the more we can continue to relay messages that vaccines are safe, they're truly working in keeping people out of the hospital and preventing death from COVID-19, the better off we're going to be. So vaccination, masking while indoors, you know, continuing to practice good hygiene, and implementing practices within your businesses that allow employees kind of the space to also not be at work when sick. I think that that's a really important piece too. We always ask, if you're not feeling well, avoid contact with others, and usually that means staying home or just staying with people within your household. So all of those things help reduce the transmission of the virus, COVID-19 and others. And the more we can keep employees, clients, and customers safe and healthy, the more they're going to be at work and be able to contribute to the economy and the community.
Of course. Thank you, Kelsey. I do believe we have Superintendent Pufall. Are you on the line?
I am, yes, John.
All right. Thanks for joining us. I'm going to give you the floor at this point. Lots of people interested in what the school district is going to do. Of course, not only parents, but businesses, as you well know, are very interested. So if you could share your thoughts at this point in time, I'd appreciate it.
Thank you, John, and Steve Pufall here, Superintendent of the School District of Janesville. Appreciate the opportunity to share information with the community's business leaders as we transition into the upcoming 21-22 school year. I'm happy to share out, with the team that, first of all, we will continue to offer the same three options to our families and students that we did last year. Students have the ability to pick or choose to be in-person instruction. They also have a choice to do virtual instruction through Arise Virtual Academy, or they can have a hybrid schedule where they would have a part of the day in person and a part of the day taking virtual classes, and that's for grades 6-12 only, though. Just in terms of where our numbers trending right now, and how does that compare to last year? Last year, we have about 9,300 kids in the district. At the start of the school year, 3,200 of those students were either virtual or hybrid. This year, fast forward, with a similar number of students in the district, at the moment, our enrollment at Arise is 301. So down significantly. How does 301 compare to the pre-COVID days? It's up about 100. We typically would have had about 200 kids pre-COVID at Arise at this time of the day. So I think it's really clear that families recognize that for the vast majority of kids, the vast majority of time, that their best and preferred learning environment is to come to in-person school for a whole variety of reasons, ranging from, I think that's where and how most kids learn best. They're fed, they're supervised properly, they have lots of opportunities to make friends and to socialize, and have trained adults who are monitoring their health and wellness and myriad other things, including, of course, the importance of parents needing to be able to go to work during the day, particularly if they have younger children. And so those options are moving ahead full steam as they have historically, and we're really excited to get our kids here next week, starting on September 1st. We will, in terms of some of our protocols, we really had high success last year. You might recall that we were all day, every day in-person instruction, pre-K through 8th grade, and we were in an A-B schedule with our high schoolers. This year, we, hope to be able to stay all day, every day at all grade levels. That's certainly how we're starting out with the school year, and hoping that the safety protocols that we had success with last year really will continue to serve us well. Not probably having enough time to go through all of those. Let me share out, kind of some of the ones that I think are kind of most often talked about. At the moment, last year, let me start with last year, we had part of that protocol was that masks were required. In June, when the case numbers of COVID really became very minimal in the community, the board went to a mask optional policy, which was in place throughout our summer school program, where we have about 4,000 kids participate. We did not have any incidents or spread of COVID during summer school with staff or students. And so, it'll be interesting at tonight's board meeting. The board will reconsider its back-to-school policy regarding masking. They've read repeadedly all of the recommendations from the CDC to DHS and certainly Rock County Public Health, along with American Pediatrics Association, and I make sure that they're monitoring all the data dashboards and other relevant information so that they're well informed to help make that decision tonight. Obviously, the Delta variant has unfortunately shifted, the trend lines in the negative direction at the moment, and the board is certainly acutely aware of that, and so it'll be interesting to see where they go with that tonight. We'll continue with all the same hand washing procedures that we had in the past. We have hand sanitizer in every room in the district. We've installed water bottle filling stations in all buildings across the district now, so that kids are never drinking out of a fountain as opposed to just filling their own personal water bottle, and so they can stay hydrated throughout the day. We will be welcoming back visitors and volunteers, which had been put on hiatus during the last school year. Again, asking them to follow the normal protocols that all other staff and students are following, whatever those might be as they relate to COVID and other things. We continue to, recognize that vaccination is critical, and as such, we partner, as we heard just a moment ago, with Rock County Public Health to continue to promote and encourage vaccination. We held 4 vaccination clinics. Really, Rock County Public Health held 4 vaccination clinics in school district of Janesville sites this summer, and those were well attended, and we look forward to continuing that kind of work as we move forward. To give you snapshot, the data as of late last week in terms of student vaccination, 16 to 18-year-old or 16 and 17-year-old age group, which is mostly our, sophomore, juniors, and seniors, are at full 42% full vaccination, and our 12 to 15-year-olds are at 32% at the moment in terms of their vaccination rate. Obviously, we'd like to see those numbers bump up here in the days and weeks ahead. And, of course, our littlest learners, our elementary kids, including through sixth grade, because that really covers that, 11 and under group, are not eligible for vaccination at the moment. Again, as we heard earlier from our health department folks, same thing at school. We ask our staff and students who have, symptoms of illness to stay at home. We're certainly continuing to try to err on the side of caution so that folks who are sick, aren't at school spreading whatever it is that they might be sick with. It's interesting to note that regardless of what the school board does with their mask mandate tonight, that because of federal rules, the transporting of kids on buses requires the wearing of masking. And so just like when you go to get on an airplane, or if you go get on a train or a city bus or a school district bus, masking is required on those buses. Our cafeteria folks will, continue to feed our kids as we have. That's certainly been one of the bright spots really throughout this whole pandemic. We're really proud of the fact that we've continued to keep kids across the community fed, anybody 18 or under, breakfast and lunch, pretty much since this has started. Those have been provided, and we will continue to do that free of charge to families throughout the upcoming school year. Finally, I think the last thing I'll highlight on the safety protocol side of things is all of our ventilation units and systems in all of our buildings either meet or exceed all the codes and guidelines that the state has for us. Pretty much all of our buildings are turning over the air in each classroom or physical space in that building 6 to 8 times per hour, and of course that air is being filtered as that is happening. So those are, I think, some of the highlights of some of the things going on this year. We have, the last thing I want to be thinking about are our inclement weather days, but we know that it's Wisconsin, and sooner or later we will deal with those. We have left or have 2 inclement weather days built into the schedule, which has always historically been the case. What is different moving forward, however, is that in the past, if we hit 3 or more days, then those days had to be made up and essentially added on at the end of the scheduled school year. We will no longer be doing that. If we hit 3 days or more, hopefully we won't, we are in a position now to be able to temporarily pivot to virtual learning for that day or those days to make sure that we are able to conclude the school year on the scheduled calendar date. And so those, I think, are some of the school, kind of highlights. In addition to that, I think it's really important to point out that while certainly academics is the core or the heart of our mission, there are a lot of other things that excite kids about coming to school. And so that includes theater and drama, the arts, athletics certainly, and myriad clubs and other experiences that make school the rich, well-rounded experience it is for kids to grow and develop. And so all of those things will be back this year. High school athletics, of course, ran last year, albeit on, a really unusual schedule. We're back on the normal schedule following the guidelines from the WIAA in terms of safety protocols for our athletes, and those high school teams have been up and running really since early August already, and we've been very successful so far, knock on wood, at keeping kids safe and giving them those opportunities. Our middle school athletic programs will be back up and running this year, as will all of our other clubs our theater programs, and all of the other experiences that we've traditionally come to enjoy here in the Janesville School District. And so I think that gives you the kind of view from 30,000 feet at least, and I look forward to, I'll yield the floor to our third speaker and look forward to answering questions from the audience when the time is appropriate. Thank you.
Thank you, Superintendent Pufall, and I'm sure we'll have some questions. For those who are listening in, if you want to send your questions to forward@forwardjanesville.com, someone will shuttle them into where I'm sitting, and I'll do my best to ask those questions. Next, we have Eric Thornton, President of SSM Health, St. Mary's Hospital here in Janesville. Welcome, Eric. Very interested to learn how the hospital and your staff are dealing with the new variant, and I suppose planning for the next variant that comes down the pike. I'll let you have the floor now, Eric.
Thank you, John. Can you hear me okay?
Sure enough.
Good morning, everybody. Thank you for inviting me to be here. I appreciate it. So from an SSM Health perspective, to be honest with you, we've kind of been dealing with COVID steadily all along. You know, there was a period of time there where we were seeing less COVID patients, but from our perspective, it never really went away. So we're kind of handling this in waves like the rest of the community. We are seeing an increase in the number of community members being tested for COVID-19. We are currently testing symptomatic patients at all of our sites. And, you know, as I said, the volume of that has picked up pretty well. We are also seeing an increase in hospitalizations for COVID-19. We're also seeing an increase in hospitalizations for other issues as well. And so the hospital inpatient and emergency rooms are getting much busier. You know, I've been asked the question a lot in terms of the inpatients we have, whether they're vaccinated or unvaccinated. And like what we're hearing elsewhere in the media, most of those folks that are hospitalized and in our emergency room are unvaccinated. We have had some what they're calling breakthrough cases, people that are vaccinated but end up contracting COVID anyway. Those people do, by far and large, those people recover much faster and they do much better. So we are, you know, there is quite a difference in recovery rates for those that are vaccinated and unvaccinated. We're also seeing a different trend with Delta, that we're seeing more younger folks than we were kind of if we put ourselves back a year. So the Delta variant does seem to infect younger people at a higher instance than what we saw pre-Delta. Let's see, I have some notes here. What else do I want to say? We do obviously continue to have COVID vaccinations here on site. We're not only providing them in Janesville, we're providing them at all of our clinic locations. So we are encouraging folks that are unvaccinated to come in and get their free COVID vaccine, whether they do that with SSM Health or one of the other many providers in our county. There's a lot of places, obviously, that you can get the vaccine, and we're encouraging folks to do that. We also, you know, just like we said last year, we all play a role in slowing the spread of COVID-19. So we do encourage folks to mask where possible, practice social distancing, as I talked about, receive a vaccine if they can, wash their hands frequently, stay home if you're ill, contact your provider if you have symptoms, all those types of things. We are providing some community vaccination clinics as well. So we're trying to go out into the community kind of every time we're invited to. And we do have we did some work last weekend with a couple churches in town. And on Saturday, August 28th, we're providing a vaccination clinic at Our Savior's Lutheran Church in Beloit. So if you know folks in that community that would want to come out, please invite them to do that. Let's see, some other notes. We do continue to have our emergency surge plan in place. We honestly never took that down. and we won't until COVID is behind us. So we are, planning for the best but prepared for the worst in terms of what could happen within our community within the vaccine. We did place in the media that SSM Health is requiring vaccination of all of our employees. And so our employees are working hard to get vaccinated for those that didn't do that already. We do allow folks to provide medical exemptions or religious exemptions, of course. And so we are continuing to work through those requests from our employees as well. And I think that's the end of my notes. I would welcome any questions anybody would have, either now or later.
Thank you, Eric. I'm going to throw the same question to you, Eric, as I will throw it to Steve, but I'll let you go first. Is there any consideration that, or maybe you already have, moved to the model where if you work at SSM, you have to be vaccinated? Where are you with that question?
Yeah, we do require vaccination for our employees. And that we are requiring folks to receive our employees to receive their first dose by the end of September. And we do allow for medical exemptions and religious exemptions for employees where appropriate. So yes, we are currently requiring that.
How about you, Steve? Has that been a topic of conversation with the staff at the school district?
Yeah, John, thank you. We, of course, are monitoring our vax rate for our staff. We're currently in the neighborhood of 93 to 94% of our staff who are voluntarily vaccinated. And so it's unlikely that we'll make this mandatory because we have such a high participation rate already, and we're acutely aware that of the remaining 6 or 7%, some of them have medical issues and religious exemptions, and so we're pretty close to fully vaccinated without mandating it.
That's great. I'm curious, Eric. You mentioned breakthrough cases. Those are people who get the virus even though they have been vaccinated. Just how common is that? What percentage of cases are breakthrough?
I don't have that data. It is for it would be interesting to have the public health department respond to that. We also only know what we see. So for patients that come into our emergency room, we are seeing a breakthrough case, I would say, every now and then, not something that's real common. It's even more uncommon for that person to end up in an inpatient status. That would be downright rare, and I'm trying to think, frankly, if we've had any of those folks recently. So it's pretty rare. Every now and then we are seeing it in our emergency department, and rarely would those folks be inpatient. So I don't have exact data. The public health department may, but it's not something that would be common or normal. But on the other side of it, it does happen.
I'm sorry. Kelsey, do you have any information on that?
I don't have any specific numbers for Rock County, but I do have some statewide data from the month of July. So it looks like for about every 100,000 fully vaccinated folks in the state, we've seen about 125 incidences of COVID, so breakthrough cases, as compared to 100,000 non-vaccinated folks. There have been 370 cases. So about a third fully vaccinated as compared to unvaccinated. But very important to note, just like it's been mentioned on the call, hospitalization and death rates are dramatically different between those two groups of people. So we're seeing a hospitalization rate of about 18%, or 18 hospitalizations as compared to 5 in the fully vaccinated group.
Okay. So you're much safer if you've had the vaccination. I have an interesting question from a caller. and it relates to this natural immunity versus the vaccination. The caller is claiming that Johns Hopkins has recently published data that shows that even though they recommend you getting vaccinated, there's no question about that, but you're as much as 6 times more likely to be better protected against the Delta variant if you've already had COVID. Is there any logic or is there any evidence that you've seen that if I've already had COVID, whether or not I'm vaccinated or not, I'm better protected against this particular variant? Kelsey, do you have any data that would lead some credence to that point of view?
Sure. So I haven't seen the specific article or study referenced by Johns Hopkins in the caller, but I can speak to immunity in general.
Okay.
So natural immunity produces antibodies. So after you get infected with a virus, your body creates a way to remember that virus next time you encounter it and can fight it off. And it's the same concept that's used to develop vaccines, although with vaccines, we're able to create very specific antibodies that can detect or remember a variety of different strains of the virus. So it's possible that natural immunity offers some protection to the Delta variant. It's really not clear. And I would likely say, and again, without seeing this study that's being referenced, we have more information about the specificity of the antibodies or the body's way to remember viruses from the vaccine. And we know that coverage for the Pfizer, Moderna, and Johnson & Johnson vaccines have pretty good memory to this Delta variant.
Thank you so much. I know some of these questions can be challenging. I guess, Eric or Kelsey, is there an opportunity for employers to invite you in to have a vaccine clinic if they have, I assume, some sizable employer base?
Yeah, absolutely. We've done several employer-based clinics so far, and that's a wonderful way to vaccinate your employees as well as their family members. So I would welcome anybody. They can reach out to me directly, and I'll put you in touch with the right person. That's a service SSM provides free of charge. We'll come right to you. And obviously, you know, it would be great if you could help us with facilities and setup and those types of things. But yes, absolutely. And I know I speak for the other healthcare providers in our community as well. I know that there's a lot of interest in doing everything we can to get our community vaccinated.
Anything to add there?
No, just absolutely the same. Please feel free to reach out to me or any of our staff, and we'll get you connected with the right folks.
A related question is, have you heard about things that employers can do that will motivate their employees to get vaccinated? Perhaps some incentives, some way of encouraging employees to get vaccinated beyond suggesting they do so.
Yeah, Kelsey may know more about this than I do. I have heard of a variety of incentive programs that employers are using. Some employers are flat out paying people for getting the vaccine. Others are doing a lottery or a drawing or some other types of prizes and incentives. It would go back to, you know, what are those things that motivate your staff and, you know, provide people those things that motivate them. But outside of finances and time off and those types of things, I can't say that I've heard of a lot else. There's also employers like us, frankly, that are just requiring it. That's an incentive. But I would welcome Kelsey to add.
Sure. So I can't speak to any specific success stories that I've heard, but we're really looking forward to see how the new initiative by the state of Wisconsin impacts vaccination rates. So if you haven't heard yet, the state of Wisconsin Department of Health Services is offering a $100 Visa gift card incentive for folks who receive their first dose of vaccine between August 20th and September 6th. So like Eric mentioned, sometimes financial incentives can play a big role in folks' willingness to receive a vaccine. One of the perks, fully vaccinated folks have different isolation and quarantine guidelines if they are exposed to somebody with COVID. So maybe they have to not isolate or quarantine at home, and maybe the recommendation is that they can still work and just wear a mask and maybe not have to use benefit time or vacation time to miss those days off of work. So there are certainly, outside of the medical lower risks of hospitalization and death, there are certainly other benefits to receiving your vaccination.
Yeah, I've heard of at least one local employer who told employees that if they do have some sort of reaction to the vaccine that takes them out for a day or two, that won't be counted against their leave. And similarly, if they suffer some sort of breakthrough infection, which, as you've already stated, is actually pretty rare, that also wouldn't be counted against their sick leave. Again, indirect incentives, but I suppose that some people may be worried about that. I get the vaccine, and what if I have a reaction and I start losing time at work and I have to use my vacation? So we'll be following up on that too. I think we're trying to collect stories, of what other people have done to incentivize. Steve, got a question for you. If the district doesn't enact universal masking, what additional steps will the district take to protect the kids in the district who are not eligible for the vaccine? Are they concerned about potential legal implications should children fall ill within the district?
Yeah, thank you, John. I think really, all of the things that I highlighted in my opening remarks are those very things that will be in place. It's just really a matter of whether masks will be an additional layer in that protocol that I described earlier or not. And so our board obviously is acutely aware that younger kids are not eligible to be vaccinated right now as compared to older kids. And, we're not really worried about a lawsuit so much. Schools have a fair amount of kind of protection from that kind of thing, as opposed to just really trying to make sure that we get it right in terms of, balancing the safety protocols and making sure we don't go beyond what we need, but at the same time, making sure that we, can keep our doors open to students and not be pivoting schools to virtual or classrooms to virtual when we may have been able to prevent that by having that additional layer of protection in place.
Okay. I have another question. It's kind of a science question, Kelsey. And some observers claim, this is the question, some observers claim the increase in vaccinations has caused the virus to mutate. If that is true, might we expect more variants as time goes on?
Sure. So I will try my best to answer this question with the information I have. Very generally, how and why and when viruses mutate is when they spread from person to person. Every time any virus is transmitted from one person to another, it has an opportunity for its genes to change and for mutations to happen. And viruses, although they're not technically living, their goal is to survive. So when mutations happen that are beneficial to the virus, they hang on to them because they survive and keep spreading from person to person. So you need transmission of the virus between people to allow mutations to happen. And the more transmission, the more mutations you're likely going to see. And then the more mutations, the more likely you're going to get one that sticks and is pretty harmful to people. So actually, vaccination prevents transmission and therefore prevent opportunities for the virus to mutate. So it's actually quite the opposite of what was suggested.
Okay.
But because we know that the virus is continuing to spread and be transmitted from people to people, we are likely to see more mutations. That's just kind of how virology works, how viruses work. So it would not be unexpected to continue to see mutations. Hopefully, the mutations don't continue to get more severe or to continue to be more infectious or more transmissible. And hopefully, our vaccines continue to be effective against those mutations.
Yeah, it's scary when you hear about a variant that is sometimes 10 times more dangerous than the last one. You start to think, okay, this is escalating now. And I appreciate your answer, Kelsey, and I think it's important that people ask these questions and get quality information like you just provided, so they're informed and they are able to prepare to answer that question should it come up when a neighbor or a relative asks it. So thank you so much. I think you should consider being a science teacher someday. You're quite good at this.
Well, thank you.
Steve, we have one more question that just came in. We know that as a large school district, we actually were able for more in-school instruction than many or most other districts. Do you expect to see this play out statewide, and we can still stand tall as the Janesville School District?
Yeah, John, just to kind of put some numbers to what your caller was describing, last year of the 15 largest school districts in the state of Wisconsin, and Janesville was the 11th in those 15. Janesville was really the only one that was open for in-person instruction all year long at all grade levels. Waukesha was open all year long, K-6 only, and virtual for older kids. And so, we're really proud of the fact that we were able to keep our doors open and allow that option to be available to our kids and family. Certainly that will be the case for us this year. Again, our goal is to be back to all day, every day at all grade levels and not on that A-B schedule in high school if we can all avoid it. And at the moment, the difference isn't really so much what we're doing. It's that the other districts, I think, are catching up, if you will, the other large districts. And to the best of my knowledge, all of them are planning to have in-person instruction available at the start of the upcoming school year.
Well, I observed what you did last year and would like to compliment you and your whole staff. I know it took a team, it took everybody to be on the same page to do what you did as a district this last year. And tough situation that you faced, and the numbers that were collected about how you managed to pivot, and the food service, and the fact that, you prevented people from getting sick, it's really a remarkable accomplishment, and so I extend my congratulations to your whole team.
Thank you, John. We really much appreciate it.
You bet. Well, I actually exhausted the list of questions that came in from your comments, so I'll thank you all one more time. Kelsey Cordova from the Rock County Public Health Office, Steve Pufall from the School District, and Eric Thornton from SSM Health St. Mary's. We appreciate your time, your expertise, and your willingness to share it with the callers from Forward Janesville. Most of you might know that I'm 5 days from retirement, so this is my last call. I've been doing this now for a year and a half on a monthly basis. It's been very interesting. It's been very educational for me. Sitting across the table from me is Kurt Parrish, and Kurt will be the interim executive director or president and CEO of the organization as of September 1st. So the next time we have a call, it'll likely be Kurt who will be talking to you as members. I appreciate you calling in and listening in. Of course, I appreciate the support you've given me and the organization for 20 years I've been here. So that is my last comment. Thank you so much for staying with us. And Kurt, you can take over from here. And I don't know what the topic will be, but I'm sure he will let you know when he figures it out. And have a good day.